announcements made, I'd like to welcome everyone to today's webinar. Today's webinar is titled Tribal Pathways to Data Analysis, Caring for Your Community by Knowing the Numbers. Our presenter today is Elaina Seep. Elaina Seep is a founding partner in the Red Earth Consulting Group, a company that is focused on creating effective partnerships with tribal nations to build long-term healthcare programs in Native American communities. She began her accidental career in insurance over 20 years ago, and she has worked in most areas of Medicaid, Medicare, and commercial insurance programs. For the past 4 years, she has been working actively with tribal communities as a consultant of Great Lakes Intertribal Council and Wisconsin's Department of Health Services on the Money Follows the Person Tribal Initiative Demonstration Grant. Elaina completed her bachelor's degree in history and legal studies at the University of Wisconsin-Whitewater, where she also received her project management certification. Currently, she is completing her master's degree in Indian law. I will now turn it over to Elaina for an introduction to today's topic.
Hi, thank you so much for having me, and thank you to our audience members for joining. I'm very excited to talk to you about this. I wanted to say a few words before we got started about how I got to where I'm at with working on data, and it's part of what I'm trying to accomplish with tribes is understanding that you can get your own data yourself. It doesn't have to be a fancy laboratory full of people in white coats scrubbing through reports. So for myself, as Julie said, I worked with the Money Follows the Person Tribal Initiative grant in Wisconsin. I left that position at the beginning of this year to work more directly with tribes to help them with some of their technical assistance needs, including data related to long-term services and supports. And for myself, I have a background in claims adjudication, and insurance, and so that gave me a bit of a different viewpoint when I was looking at data and hearing over and over again comments that, well, there just isn't any information about people in Indian country. We don't have Native American people enrolled in studies. And I thought, well, we may not have people enrolled in studies, but there have to be different ways to look at this and get that information. And my different way of looking at it was saying, well, we know where people have been, and we know what services they have used and they're using right now. And that's a good start at looking at your community through the data that you have all around you. And that's what we're going to talk about today is kind of what is that data and where to look for it. Could we go to the next slide, please? So as we get started, I want you all to kind of think about how confident you feel about finding healthcare data in your community. Next slide. When we hear the word data, like I said a bit ago, we tend to think of a group of scientists in a lab, but it's really not as complicated as that. And it can be easily accessible if you just know where to look. So one of those basics is understanding what data really means. It could be the result of some sort of long-term study performed by a group of researchers and scientists, but it can also be as simple as organizing the claims reports from your tribal clinic, looking at your elder health and wellness surveys that everyone completes for Title VI grant funds. You could also determine what services your tribe is performing in each department and then relate those to how people are using those for healthcare needs and disability needs. Things such as transportation that's wheelchair accessible. That's something that's related to long-term care. Home modifications to build a ramp for that person in a wheelchair. That's also a long-term care need. So there's all of this long-term care data scattered all across different tribal services. We just need to start looking at it differently and use that to tell the story of your community. Next slide, please. So what can data tell you and why is it important? I have a few points here, but I also wanted to say data is often used as a tool to support an action or an idea, or alternatively to tear those things down. When tribes own and manage their own information, they create a picture that's seen by the county, the state, federal agencies, rather than the other way around, of having a picture of their community presented to them by outside sources. A great example of a tribe owning their data is in Turtle Mountain, where they created a tribal data governance board, and it's an excellent example of how important data ownership is and how data can be used like fire, for good or for bad. And knowing your data is a critical step in building a really strong long-term service and support program for your tribe. And data about your elders and people with disabilities, such as occurrence of illness and disease, cost of providing care, and what services are being used now, will help you plan for a successful and self-sustaining long-term care program. Some of the uses for that data is you can use that data to figure out costs and budget, and use that to create a plan that you present to your tribal council, because we all know that tribal council also needs to know what money's coming in and where and how something's going to be funded. An example of how the data can be used to figure out those costs is in 2013, in the state of Oklahoma, all of the tribes together provided over 480,000 home-delivered meals to their elders under the Title VI grant program. And that information is out on the Administration of Community Living's website. It is a tool that you can use to create state-specific reports, and we'll talk about that a little further into the presentation. But those 480,000 plus meals, if they had been billed to Medicaid, the tribes could have received a reimbursement of over $2.3 million. But they would have needed to bill Medicaid for that, and they would have needed to know who was enrolled in Medicaid and who might be eligible for those services based on their medical conditions in order to begin that billing. But that right there is just an example of how you could look at something you're already doing and gain data from that. Another way we can use that is we all know that Alzheimer's and dementia is on the rise among elders in our communities, but we keep hearing over and over from places like the Banner Institute and even IHS that there's not enough information related to this disease when it comes to tribal communities. And while that may be true because we don't have Native people enrolled in great numbers in long-term studies, there's still information to be had about people and dementia and Alzheimer's. You could start looking at your own health programs and aging programs where you're helping people with those diseases and start seeing how soon were they diagnosed, what age are they, what gender, is it more women or more men in your community? There's a lot of information to be had. Next slide, please. So before we get more into the meat of how to start finding your data, one of the things I'd like everyone to think about is what story do you need your data to tell? Because that's what you're doing with that information. You're creating your community's story and telling about their needs. You're telling about what the average person is doing or experiencing who maybe has Alzheimer's or who maybe is quadriplegic and in a wheelchair. Your data is telling the story of their needs and their importance in your community. Next slide, please. So how to get started in finding your data, one of the things that you want to be thinking about is decide what information is it that that you need? What do you need to know about? And that will help to start developing those details. As I said just a moment ago, there are many government departments and research facilities that would like to recruit Native American people into their studies and projects, and each of those facilities are concerned about the lack of tribal data, but there is a lot of information to be found right at the level of your own community, as well as potentially gathering information from your state and also federal sources as well. In planning for long-term services and supports, one of the things you'll want to know about is you'll want information about your elders and adults with disabilities. So what that tells us is we now know we're only looking for people who are age 18 and older. And while that sounds really simple, and you say, well, of course, Elaina, we're looking just for adults. But that means that you now know you don't want to look for information for anyone younger than that. So you're starting to narrow down the characteristics of your population. Next, for planning for long-term care, you'll want to know things like, well, what illnesses and disabilities are present in your community, specifically the ones that could lead to a need for long-term care. And also, who out of your population in your community has those conditions. As you start to get to the who and the what, these are going to be parameters and statistics at the core of your data. And you can look for these details in a few ways. I mentioned before about going to your tribal clinic or other health programs. If you have a health center or a community health program, obviously if your tribe is managing any of those sorts of things, there should be and will be information on illnesses and disabilities within your community. However, another source of information are county, state, and federal programs and departments. There is a lot of open source information available online with census data and federal report tools, Title VI surveys. And this also gives tribes an opportunity to form a partnership with those resource centers in order to gather meaningful information about your tribal members. However, an important detail to remember as you approach external agencies is that they have a duty to protect the health information of individuals. And so you'll hear people refer to the Hipaa Act, which is the Health Insurance Portability and Accountability Act. However, one thing to remember is that tribes are considered public health entities under the privacy notice of Hipaa. And what this means is that for the purpose of continuing and administering care programs in your community, your tribe has the right to request and receive protected health information about your members. So those requests can be made of state and federal agencies, and sometimes it takes a reminder of what your authorities are and where they lay with your sovereignty. But as you make those requests, just know that you may be asked to provide a list of your enrolled members so that your member data is delivered to you. And what I mean by that is, for example, when I worked on the Tribal Initiative Project, I was working with a specific state, the state of Wisconsin. Well, there are 11 federally recognized tribes in Wisconsin, but when people go to their doctor and use their Medicaid benefits, while data may be captured that they are a tribal member, beyond that, I couldn't tell you, looking at that data, which tribe they were affiliated with. So I couldn't and the state couldn't just print out a list and give it to a tribe that requested it, because there wouldn't be a way to tell that they were giving that particular tribe their own members. So when it comes to your rights as being a public health entity, it really is being a public health entity in your own community. So you will have some work through with state and federal agencies to ensure that you're getting your members. I just want you to be aware of that. I wouldn't want anyone to be surprised by that later on. You'll also need to plan for things like privacy agreements between your tribe and any agency that you're wanting to exchange this information with. And then you'd also need to plan for how you'd like that information delivered to you. It needs to be in some secure manner. Private health information is seriously protected, as you would expect it to be. So just be prepared as you work with these other sources to think about patient privacy. Go to the next slide, please. It was so important that I made it its own slide, and that link is right to the HHS website, to the professionals link, all that you need to know about HIPAA and about PHI, which is personally identifying health information. And as I mentioned, there's an expectation that any tribe, government agency, or any other program handing out medical information will guard the privacy of each patient. And as you start to work with your own data, I would recommend that you get familiar with the Hipaa Act and with the expectations of guarding privacy. Under Hipaa, only specific people, they're referred to as entities, so it's as a whole, are legally able to access this private health information, and only for specific purposes. Otherwise, you would have to get each patient's personal release of information form, which could take you a while. Now, I'm saying it's impossible, but it's not the best way to do things. But since, as a tribe, you're considered public health agencies under HIPAA, then you would be considered a covered entity under the PHI amendments. Excuse me. And as long as you're using the information to continue to deliver health programming and better the health and well-being of your community, as is your sovereign right. Next slide. So now that you have your data, what do you want to do with it? You have a pile of information, and where do we get started? Well, the easiest way to begin is with deciding how you're going to organize it. If you have an IT department, if you have resources for data analysis, you could create a database that you could run a SQL query on, and a SQL query is just organized questions of your data that then delivers a report. That's not an official definition, so take that as it is. Now, my preferred method, as I said, since I was doing this kind of on my own and looking at it from a different perspective than someone who was going to come in and build a database and make these fancy queries, I personally am a fan of the Excel spreadsheet. By using an Excel, I can drop a large amount of data into a page. I can apply filters. I can sort my data. I can remove duplicates. Now, obviously, Excel is limited because the more information you put into it, the harder it is to work quickly. So you could break up your data into smaller pieces or different pages, but it's just a really quick and easy way to turn out some really nice reports. I'm able to begin narrowing down my data out of a spreadsheet and then start picking out even more specifics. So some of this, if you have, as I said, if you have IT resources, could probably be turned into some sort of an automated database. I am not a person who could build an automated database, so I won't even go into discussing that because I would have nothing to tell you. However, if you are using a simpler method to sort it out, you could sort and filter certain pieces of data, such as looking at all of the people aged 55 and older, and then start creating reports and charts from the information that you found. As an example, when I was working with large collections of state Medicaid data in Wisconsin, I was looking for people who may have a need now or in the future for long-term care services. Now, like I said before, I knew this meant that I only needed adults 18 and older, and so that was my who. So the first step I did was I eliminated records for anyone under the age of 18. So now I had a smaller pool to work with, but it was still full of information and people that I simply didn't need. I didn't need to know who had the flu or who had, was having a baby. I needed to look for people who had an illness, an injury, or a disability that could lead to a nursing home level of care. So this was the what that I needed to know about. And that was the core focus of my reports later on. So I went through all of those claims for the people over 18, and I pulled out those routine illnesses like the flu or pregnancy, until eventually what I was left with were people with serious health conditions or disabilities. Now, because I was working with the state's Department of Health, I already had my source or my where. My where was the Medicaid claims data. Now, just as a side note, as you start going through your own data and looking for information, I would suggest that you pick a time frame that you want to collect information from. As an example of Medicaid data, if I were today in 2017, if I wanted to look at the most recent batch of claims, you would think that I might want to pull claims from the year 2016. But actually, you'd be wrong. I'd want to look at 2015. And the reason being is that anyone who's enrolled in Medicaid, a Medicaid provider has 365 days from the date of service to submit a claim. So if someone went to the doctor on December 30th for a diabetes checkup, December 30th of 2016, that doctor has until December 30th of 2017 to submit that claim. Now, some states may have different rules and may have a shorter time frame, but in general, it's 365 days. So you want to pick a year or a time frame that it's mostly resolved, or that you know all of your information and numbers have already been dealt with and are in place before you start running reports off of them. Once you pick that time frame, you may also decide that you want more than 1 year. You might want 2 years of data, and that would let you do a comparison between those 2 years to see if there are any differences. Maybe your tribe started a diabetes wellness program, and you want to, and in that year, your tribe's number of members who were being diagnosed with diabetes went down by 15%. Well, if you had 2 years worth of data, you would actually see it go down. You could compare the year before where, the number of people with diabetes was, say, 200 and something, and then the next year it was 150 something. So if you have multiple years, you can compare them to one another, and then you can start to see how things go up or down and use that to create reports. Next slide. So we had talked a bit earlier about storytelling and data. Once you've sorted your information and you've narrowed it down to a specific group of people, their diagnosis, and the services that they've used, how do you report it, and what do you report? Well, the what you report depends on the story that you need your data to tell. Perhaps you want to report on how many elders have been diagnosed with or treated for Alzheimer's in the past 2 years. Well, you now have information to paint a vivid picture of those elders by including averages such as the average age of someone with Alzheimer's, the gender, the top 3 services perhaps being used by people in your community who have a diagnosis of Alzheimer's. And as you start to create reports, one of the first things to do is be prepared to count. Make friends with mathematics, or at least bribe someone who's really good at math. You'll want to calculate totals such as the number of people, the number of elders, number of women in comparison to number of men. So as you start to go through all of this math, there's a huge room for individual error because you're only a human being. Even using a calculator or some of the functions in an Excel sheet, you can still type a number wrong. So it's always important to have another person check your work to ensure that it's valid, that you typed things in right, that your numbers add up, and also that numbers that you're reporting can be duplicated, that they're the same. And as you consider what you want your data to do, that consideration of what you want it to do may make a difference in whether you report things as whole numbers or percentages. So in my opinion, it's especially true of tribal data because sometimes you are working with a smaller number of people if you're a smaller band or tribe, or you have limited data available. So, for example, if you only had 10 people and 5 of them had a particular disability, well, it's more impactful to state that as a disability rate of 50% rather than reporting it as 5 people. So it's the same information. You're still talking about 5 people. 5 is 50% of 10, but you've just expressed it in a much stronger and more impactful way in order to tell the story that you're trying to tell. Also, when you are presenting your data, you want to be aware of who you're talking to. That's going to, are you giving a report to tribal council? And you know that they want to know specific things, and they also need to know it in a very accessible way, like maybe a few visual charts and graphs. Or are you presenting it as a paper to a state or federal agency as a discussion of disparities or barriers within your community? Then you may have some statistics that are scattered throughout a paper with maybe a chart or graph here or there, but most of it being more discussion points. So now that you've pulled this all together, you're on the verge of needing to create some graphs and tables and also some neat pie charts, and I do promise that it's not as hard as it looks, and this is where working even with Microsoft Documents as well as Excel is really helpful in putting together really useful tables. Next slide. So this is a sample chart that I made out of some census data. So this isn't from any particular tribe. And this was all readily available online. And what I did here was I used the chart making function in Microsoft Documents. There are several ways you can insert a table and draw a table, and then you can highlight it in different colors. There's also a smart art and that shows you all these different types of charts. This is an example of an exploded 3-dimensional pie. And when I chose that for my data, what happened was another little window popped up that looks like a miniature Excel spreadsheet. And I just put in my headings and I put in my percentages, and then it gave me these little, it put my headings to the side where you can see that I have the different, like blues, American Indians only, and then that reddish pink color are people who reported more than one race along with American Indians. And so sometimes you need to play with those charts a little. You can always go back and change the type until you get the visual that you want, but it really is very user-friendly and is a nice way to make something that looks very professionally done and very sharp and turns your numbers into just a good presentation and a good representation of the story that you're trying to tell. The next slide, please. So just to wrap up a bit here, these were the big main points that I wanted to take away from today. The first was that data is really any piece of information. Information and data are side by side, and that you can use that data to tell a story and to prove or disprove a point. That's so important to have your own data and tell your own story, and that data really is everywhere. You just need to know how to look for it. So don't ever think that there isn't data about your tribe or your band. You just need to look at it differently and decide what story do you need to tell and see how those details start to fall into place. and that's going to start you down the path of what you need to look for, who you need to ask about it, and don't be afraid to create something new. I know that with the Title VI surveys on the web page, they actually have some guidelines for creating your own surveys for elders in your community. Those could easily be expanded to include people with disabilities, and it's a really nice walkthrough on how to write a survey for yourself. And once you write your own survey, you can be the one to talk to your own community and get their answers and their responses back and collect your own data to tell that story. So next slide. So I asked you at the beginning about how confident you felt about finding healthcare data in your community, and I know this was just the tip of an iceberg of a presentation. This is a lot of information to take in, but I hope that you have a little bit more of an understanding of what data is and where to get it, and that you feel more confident that you can find this long-term services and healthcare data for yourself and your community. And then if we go to, the next slide. This is a list of some resource links. There is, through the Administration on Community Living, they have created an aging integrated database. And so all of these links you can click and open up right to these different tables and reports where you can run some of your own custom reporting that goes either you can look it up by state, you can look up even by tribe, like all of the Title VI information, you can actually get specifically to your tribe. And I think I have this set where if you click on that custom table, it actually takes you to the tribal link. And you can look for your tribe and see exactly what you reported all the way up to the year 2014. That's the most current year that they have. That is actually the information that I use to find out about the home-delivered meals in the state of Oklahoma. So I was able to go to this website, look at all the tribes, and see just home-delivered meals, and that the number was over 480,000. Well, then I was able to look at the state's website and find that they have a list for certain Medicaid waiver services, like home-delivered meals, that tells you their rates. And in the state of Oklahoma, the rate for home-delivered meals is $4.88 a meal if it is on someone's plan. So from there, it was just math. I multiplied that 480,000 plus number by the $4.88 to come up with a potential reimbursement of $2.3 million for home-delivered meals in Oklahoma. So I went to more than one place and got some really specific, really important, exciting information. And all it took was some of my time. And I didn't have to get a scientist. I didn't need someone to build a database for me. It was just time and looking at things a little differently. Go to the final slide. So I hope that you got some useful pieces of information out of what I talked about today, and I certainly welcome questions and comments that you may have. I know we've got some time here, probably a little bit more than we had anticipated, so hopefully that doesn't mean I accidentally skipped a slide. But otherwise, if you have other questions and comments that we don't get back to today, please feel free to contact me, and I will do my best to answer your questions, or at least to show you where you can find that information and data at. Thank you.
Oh, great. Thank you, Elaina. So we will take questions from the audience. Please enter your questions for Elaina in the Q&A box located at the bottom right side of your screen. Throughout the presentation, Elaina, we've had a few questions come in, so I'll go ahead and just start at the top, and we'll work through. So this is more of a comment, and perhaps you can add to it. But this audience member had asked for mentioned, it would be helpful to get a reference that documents that tribes should be treated as public health entities for data requests. Do you have more information about that?
Could you repeat that one more time, the very last part about it would be helpful to get a reference?
Yes. Is there a document that references the fact that tribes treated as a public health entity? Mm-hmm.
It is written into the privacy section of the Hipaa law, and that link on the slide, where the slide that talks about HIPAA and private protected health information, PHI, that link right there will take you to a provider webpage, and there's also a choice on that page to view the actual documentation of the Hipaa Act. What you want is just the privacy notice of Hipaa, and there's a whole list that talks about covered entities, and it's just a little sentence that says, and for the sake of Hipaa and XYZ, tribes and tribal entities are considered public health authorities. But it's a specific sentence within the privacy notice of Hipaa. So I don't know of a particular document that just lays it out other than Hipaa, but I could certainly try and work with Julie afterwards. Maybe that's something that Kaufman would put up a link to Hipaa somewhere. I don't want to speak for you. Otherwise, if you get in touch with me, I will see if I can pull that notice out and just send you that paragraph, as well as exactly what spot in the Hipaa law it's at, because it is a pretty extensive legal read.
Yeah, so to follow up on that, Elaina, yes, we will be sending out a follow-up email to this webinar, and we can attach some information about this particular document in that follow-up email.
Perfect. Oh, I don't want to cut off people's questions, but one of the things that I forgot to mention was when you're looking for sources of data, a really good one, and this would require working with the state, but it's worthwhile, and that's the MDS, and that stands for Minimum Data Set. And what it is all of the different intakes and reports and reviews that a person goes through in a nursing home. And all nursing homes are required by federal law to report those back through the state, and then the state reports that to the federal government on, I believe, a quarterly basis. But what that tells you is it has so much information. It has information on, where someone is, what their admitting diagnosis was, if they were admitted from the community, if they were admitted from a hospital into that nursing home. And then it's a series of different health reports that are done throughout their stay. And then that way you can see, if they have a diagnosis of they've had a stroke, but they also have diabetes. You'd be able to see that. But again, that would also be working specifically with the state to get that information, and would involve working out a plan to identify just your members to the state, because they wouldn't release everyone else's data to you. It would have to be specific to your members.
Okay, so the next question I have, Elaina, actually touches on that last comment that you made. This audience member notes that tribal and IHS clinics can and do serve all Native Americans who live in that area, but who may or may not be enrolled with, or who may be enrolled with a different tribal nation. How does Hipaa treat data sharing in that situation?
Ooh. Well, I think you may be getting out of my depth, but I would think that then you're talking about the covered entities and the purpose. So if you were a tribe that was working singularly to find information really just about your tribe, then as a tribal clinic, you could not use data from people who weren't your members. That's a little tricky, and it would have to depend on what you were going to use it for. Now, let's say you were a clinic that the clinic itself was doing some kind of a paper about all the services that they provide and perhaps why they need more funding, then you're talking about trying to expand your clinic services, serving all patients, and you're using numbers. Presumably, you're not looking at specifically identifiable information. So that's something I'd have to look into more, and I would really think that that's a deeper conversation than I could give you right now. I wish I had a better answer.
Okay. Thank you for that. So the next question that we have refers back to when you were describing how to sort information, and this question asks, did you sort the disease from the claims data with the ICD-9 or ICD-10?
Yes.
Okay.
As well as the descriptor. So whenever you're capturing claims data, and if you're doing it at a clinic, not just looking at state Medicaid data, if you're doing it at a clinic as well, and I've worked in a clinic before too, there should be a description of your diagnosis code, just like there's a description of your CPT code, which is your procedure code. When I pulled my big report, I used both columns, because that way if a tribal clinic hadn't switched yet from ICD-9 to ICD-10, I had the description so I could sort people out appropriately. So maybe there was a slight code change that really made a difference between whether, and I'm making this up, but there could be a slight number change that made a difference between what used to be diabetes is now something like multiple sclerosis. Well, they're both still diseases I would want to know about, but if it was a difference between diabetes and having a wart on your finger, then I want to see that description that the tribe was using for that day, for that diagnosis, so that I know I don't need the people with the warts on their fingers. I can eliminate them from my pool, but I do want the people that have diabetes or multiple sclerosis. So I used both, the descriptor field and the actual ICD-9, ICD-10 code.
Great. So the next question we have comes in. Do IHS data sharing protocols exist? Something
I'm not sure.
Database. Okay.
I'm really not sure, because when I started working with the state Medicaid data, as far as I have been able to tell, going to a couple of conferences, no one else has been looking backwards at claims data like this, which was partly why I wanted to share it with tribes. When I went to the long-term services and support conference for American Indians and Alaska Natives in November, that was held in Minnesota, and Bruce Fink, who is a doctor who's one of the heads of an IHS region and works with ACL, gave a talk in which he said, well, we don't have this data and we don't have that data. And I actually stalked him outside after the presentation and cornered him, and I said, well, what do you think about this? Like, here's what we're doing over here on this project in Wisconsin, and we're looking at MDS data and we're looking at Medicaid data, and no one had suggested that to him before. So I don't know that they do have a protocol yet for sharing that data, but I know that if people start asking for that data to be shared, they're going to have to start creating a protocol pretty quickly and working with tribes to do so. So whoever asked that question, you could be the first one to pioneer that.
Okay. So our next question is, do you have other examples of how tribes have used their data, similar to the Medicaid reimbursement for meals examples you shared?
Wow, not really. I mean, that's it. I could tell you things that we did on the project things that I'm talking about with some tribes now. Actually, I can give you a good example that I heard in someone else's presentation, and this came from Turtle Mountain creating their own data governance board. And if you have the chance to hear Anita Frederick speak about Turtle Mountain's experience, it is very informative and it's fascinating. And how they wound up creating a data governance board was there was some research that they gave permission to a group to use tribal data and come in to their community, and they expected to see the report afterwards, but they really didn't have anything formal telling this group of researchers how they could or couldn't use that tribal data. And the resulting report and article wasn't one that the tribe agreed with. And they decided it was time that they started controlling that. And since then, Anita has gone on to find discrepancies in data. She's gone to some meetings in Washington, D.C., including meetings with IHS, where she's pointed out that some of the data being used or being quoted isn't necessarily correct, or it's old because the source that it tracks back to was old. So I don't know I hope that kind of gives you an idea of what you can use data for. I mean, it really is limitless. You can use statistics to talk about, access issues that your tribal members are having, getting back and forth to providers. Say you're a tribe that lives way up north in Wisconsin, since that's where I'm from, and you're closer to providers in Minnesota than you are to Wisconsin. Well, then you need to show some of that data and use that to tell the story of why you might need more funds for providers in your area, or why that's an opportunity for the tribe to then become that type of provider to keep people within the state and also to give them access closer to where they live. There are a lot of examples, and I'm sorry I didn't come with more than that.
Okay, great. Are there any other questions from audience members? We have a few more minutes that we can use to pick at Elena's brain. If you would like to answer or ask a question, please enter that into the Q&A box.
And thank you again for the questions so far. I have to say that it's a little odd because the only person I can hear is Julie. So it's a little like having a really long conversation with myself. So I appreciate you all calling in and having some questions, and I really do hope that this information, if it's not been useful, if it's at least started some conversations amongst you and some thoughts going in your brain of places you could go and look for data or things that you could.
Okay, so we've received no further questions that have come into the Q&A box, Elaina. So we can go ahead and move towards closing this presentation. In closing, I would like to remind everyone that today's webinar was recorded and that the audio and PowerPoint will be made available online at cms.gov. You can also request a copy of the presentation by sending your request to the email address ltssinfo@kaufmaninc.com. And I will be following up this email with a follow-up, which will provide information and resources that were discussed and requested during this time. Thank you again for joining today's webinar. I'd especially like to thank Elaina for joining us and sharing her expertise on this topic. Our session is now concluded. Thank you.